Sure. So I'm presenting on behalf of several co-authors the results of our phase 2 study. It's a phase 1/2 study. We're presenting the phase 2 portion in the adenocarcinoma arm of this prostate cancer-directed trial. The agents that are being evaluated is a drug called Bioxyl 701, but it has a name called Talabostat, in combination with the well-known drug Pembrolizumab or Keytruda. This drug Keytruda has been approved in probably over 12 other tumor types, but in prostate cancer, it has modest or minor activity. And that's a surprise because prostate cancer, we feel, should respond to immunotherapy because of the approval of Sipuleucel T nearly 11, 12 years ago, but a little bit disappointed in the activity in prostate cancer. There is activity, but it's relatively small. Some of the rationale for why we're not getting the response we hope for is that we believe that prostate cancer is somewhat of a cold tumor. That is, the microenvironment around the tumor doesn't appear to have as many immune cells as we would expect, and perhaps what's seen in other tumor types. That's at least the theory. Based on that theory, we're evaluating Talabostat, which is a inhibitor of a couple of enzymes that may lead to a recruitment of immune cells to the tumor microenvironment. So that's the rationale, and it's past phase 1, is found to be safe without dose-limiting toxicity, and so we have the right dose. And so there's 2 cohorts in this study. One is for small cell prostate, but the one we're discussing in the poster is for adenocarcinoma. So the results are somewhat preliminary, but enough to present. We're presenting 32 patients with limited follow-up. And what is encouraging is that our response rate, which is described as a composite response rate, which encompasses a few relevant outcomes in guys with prostate cancer, including RECIST response, which is not common in prostate cancer, but we did have some that were eligible. PSA response greater than 50%, conversion of CTC cells, and disease control rate, which included stable disease, partial response, and a couple other things. And when you put all that together, pre-specified benefit was met in nearly 26%. So this, we think, is encouraging, suggests that we should keep moving. The study is still enrolling. Not just efficacy, as far as toxicity, again, somewhat delineated in the phase 1, but we're still watching closely. And the toxicity seems reasonable in the phase 2 setting.